welcome to YouTube Live number 2. Although technically I think this is number 4. We've had some sizing problems. I think yesterday we were crooked for a while, but I think we got it figured out here. Yesterday I talked about case study number 1, and I talked about why it's important. And I don't want to spend a lot of time talking about why it's important. Just be aware that the most important variable is providers do not have to publish outcomes. And because they don't have to publish outcomes, nobody knows what the actual benefit of the treatment is or how it compares, more importantly, to somebody else. And that if patients understood what the outcomes were for different types of therapies, they can make better decisions. So this is all about patients making better decisions. That's why we do this. We talk about what the benefit of care is for different programs. So yesterday we did case study number 1, and today we're going to do, I said case number 2, but the person that writes the case studies isn't here today, so I grabbed the one on top of the pile, and that was case study number 138. But this is a good one. Why is this a good one? Well, we'll do this again. 58-year-old patient came to see us, a man, 58-year-old male. Had back pain and sciatica and had suffered for 5 years. Not a brand new problem. So there's different kinds of problems. There's brand new problems, and I've had an old problem that's not going away. This is an old problem not going away, 5 years. Before coming to see us, saw a few other doctors, had an MRI and an X-ray, which is pretty consistent. It's pretty consistent with the treatment protocol. When you go see other doctors, you'll get some sort of imaging for a diagnostic. In his case, had an MRI and an X-ray. Before seeing us, had seen physical therapists, but had seen different physical therapists and had gone through different programs. Had tried a lot of anti-inflammatory medicine, then came to see us, 5 years post original problem. We sent the patient for an MRI, and we diagnosed the patient with a retrolisthesis, which is a shifting of the bone, a little bit like what we talked about yesterday. Had a degenerated disc, where the disc is breaking down, the vertebrae are getting closer together, and as the vertebrae get closer together, very often it'll compromise the sciatic nerve. Patient had sciatica. Had a bulging disc, where the disc is bulging out a little bit into the spinal canal. Had stenosis, which is a narrowing of the opening. And all of these problems are consistent with giving a narrowing to the opening where the nerve comes out, causing the pinching of the nerve, causing the sciatica, but also has scoliosis. And scoliosis is just an added sort of problem to the spine where there's a curvature that overloads the joints, and the overloading of the joints leads to all these problems. So patient comes in to see us, we do our diagnostics, we put the patient through our testing, our analysis, our evaluation, identify the source of the problem, these problems here, formulate a treatment for this problem, and we have the ability to address at a deeper level problems inside the spine, the discs, the stenosis, and more importantly, sciatica. So we have a 9-step solution for sciatica. It's a path, have you go down the path, and as you go down the path, you start to get better. So this case came in to see us. When the patient started, had a back pain and sciatica. On a scale of 1 to 10, the pain was an 8. It was an 8 out of 10. 10 is the most severe, 0 is I have no pain. This is pretty bad. This is pain that tends to consume you, okay? And we know how much pain consumes you by giving you a questionnaire. It's called the Oswestry Disability Index. It's a 10-question questionnaire, and if you fill it out, we score it, okay? This questionnaire is scored from 0 to 100. 0 is the pain has no effect on my life. 100 is I can't get out of bed. 100 is the pain so bad I can't handle it much longer. Okay? So it's scored from 0 to 100. It's broken down into 5 different categories. I'll go over these briefly, kind of important. 0 to 20, minimal disability, means the pain has a minimal effect on your life. It means you can live most of your life without much of an effect, but there is an effect. Okay, 0 to 20. 20 to 40 is a moderate disability. moderately disabled, okay? Pain's slowing me down, hard to do a lot of my daily activities. 40 to 60 is what we call a severe disability. Above that is what they call crippled. From 60 to 80, the pain is so bad that you can barely live your life. 80 to 100, you're not living your life, you're really in bed, you're bed bound. Okay? So in this particular case, this patient was a 58. A 58 is pretty high. The one thing that we do know is one of the markers for whether or not you need surgery is sciatica with some sort of disc problem in conjunction with the fact that you've got an oswestry, an ODI above 40. So if your questionnaire is above 40, you now are a candidate for surgery. So patient came in, we know that they tried different physical therapy, anti-inflammatories weren't working. Pretty severe back problem. Pain was an 8, oswestry was a 58, okay? Long time, having a back problem, high score, takes a while to get better. But what we know is they do get better as they go through our program. We have a very specific 9-step process. Patient went through the program. 39 treatments, a little bit more than normal, okay? But in his case, had a high oswestry, okay? We call this a high oswestry. We want to get you into a safe zone. Safe zone is down below 20. Down below 20 and life is good, okay? Pretty high. 39 treatments. Saw our doctors, saw our therapist, went through the program. At the end of the treatment, back pain was a 2. 2 is tolerable. 2 is not great. Our goal is a 0. Back pain was a 2. Oswestry was a 16. Okay? He's living his life again. He's doing the things he wants to do. Okay? When you're here, you're not doing much. You're not living your life. You're less human. Okay? We have a segment we call Humans because our goal is to make you more human. Make you do more of the things you want to do. Help you do more of the things you want to do. At this point, feeling better. Now, the reason I like this case study is because pretty severe back problems. Had tried other things, not gotten better. Had this problem for 5 years. Okay, so this isn't I just woke up this morning with back pain. This is I woke up 5 years ago with back pain and it's not going away. Okay, that's this patient. So, put him through the program. Obviously, in what we call the safe zone, able to live his life, feeling pretty good at a 2. Followed up with the patient 3 years later. We do follow-up. We do follow-up to say, how are you doing? What's going on? Followed up 3 years later. Patient's back pain now is a 0. And the oswestry disability index is a 0. Did not get any outside intervention after they saw us. He went through the program. He was done with the program. We give him simple things to do at home. They're not complicated. If we give you complicated things to do at home, you wouldn't do them. Okay, we know that we can't make it complicated. 3 years later, the back pain went away. Okay, I like this study because severe back problem, high oswestry, absolutely 100% candidate for surgery, didn't get the surgery, came in to see us, went through our diagnostics, went through our exam process, put him into the system, 9-step process, followed through, 39 treatments, back pain gone. 3 years later, back pain gone. Completely. Now, there's no pain now. Okay, and he suffered for 5 years. This is a great case study. They're all great. But this one, I liked it because of this one right here. Okay, we know as you go through the program that this number gets better, and if you do what we tell you to do afterward, not complicated, we're not asking you to run marathons, just real simple stretching exercises, no big deal, something you probably already do. Okay, pain goes away. Why do we do this? We do this so you can make better decisions. I came across a research article this morning. I was going to review it today, but today's election day, so I'm going to review it tomorrow because I have to go vote. Okay? So we'll talk more about how to make better decisions, but you have to understand this is what can happen. This is outcome. This is outcome. When you understand outcomes, you can make better decisions about how to treat your back pain. I know, because I suffered with back pain for years. So tomorrow, we're going to do another case study. I'm not going to say it's case study number 3 because I don't know what number it's going to be. We'll try to get number 2 or number 3 tomorrow. But here's where we're at. Thank you very much. We'll see you tomorrow. Go vote.